Germany is this morning sounding the alarm over a COVID vaccine being made here in Australia. Health officials there advising the AstraZeneca jab should not be given to people over the age of 65.
We're joined now by the New South Wales President of the Australian Medical Association, Dr Danielle McMullen. Doctor, thanks for your time this morning. This is not going to help with people who are already worried about vaccinations.
Yeah, look, we've heard a bit of back and forth about this over 65s group and the AstraZeneca just over the past few days. And I know that our TGA groups and our ATAGI vaccine advisory groups have been looking specifically at that over 65s population. They're obviously a key group for COVID vaccines. So I'd hold back for a sec yet on really passing judgment on how effective this vaccine is in that group or not, because I think the jury's still out, and I know our groups are going to be looking at their own deep dive of the data that exists.
This kind of weighs heavily, doesn't it, on the public expectation and the public belief that this has been rolled out very quickly. Is there any real concern that you can see here with this particular vaccine being rolled out to the over 65s? Would you encourage people to have it still?
We'd certainly, we haven't seen any safety signal concerns around the AstraZeneca vaccine in the over 65s, and I'm sure they'll be looking at really, the level of efficacy that it has in different groups. We're going through all our usual processes for approval, and in fact the AstraZeneca one is yet to have TGA approval in Australia. We're expecting it soon, but it's not quite ticked off yet. So people do need to realise the vaccine program is going to take most of this year. It's exciting that we've finally got the ball rolling and some concrete things starting to happen. But it is a serious process that is going through its phases.
But if you've got German scientists and doctors saying, hang on, we don't think AstraZeneca works for those over 65, or we have concerns about it. We had deaths linked in the elderly with the Pfizer jab. And when you consider who are the most vulnerable here in contracting COVID, are those over 65, this is potentially a real drama.
As I said, it really depends on different countries are debating really that AstraZeneca issue, even as of this morning. It's only over the past couple of days. So if it really isn't effective in that group, then yes, we maybe have a concern, but I think the jury's still a bit out there.
It erodes public confidence. That's one of the big issues, isn't it?
It can, yeah. I think sometimes playing out all these details erodes confidence. A lot of this stuff would be debated with any vaccine behind the scenes, and what we're seeing in COVID is all of this science kind of playing out on our TV screens, which is a unique thing. I don't think scientists are quite so used to talking to the media all the time, and it's a new role for all of us to be.
But effectively, there are concerns with the two vaccines that we have access to in Australia, which does raise the question why we haven't broadened our access to vaccinations like Moderna. Did the government drop the ball here? Should they have looked further afield?
I think I'll clarify. So we are still using the Pfizer vaccine in over 65s. We're not worried in a significant majority in terms of safety there as well. And the bulk of our aged care will be vaccinated with the Pfizer vaccine. So I do want to reassure people that that is safe. And our guidance there is to use some judgment about the very frail elderly, which would be the case with any vaccine. The government, I know, is still working on trying to secure vaccines. We think they should get as much access as we can to as many variety of vaccines as we can, and understand that there's talks underway to be able to keep that up.
Yeah, I mean, what is it, 50 million doses of AstraZeneca? I mean, if there's an issue...
The advantage is because we can make AstraZeneca onshore here, and we've also seen the issues with distribution across Europe of some of the vaccines. It'd be great to make as many as we can here.
OK, meantime, 11 hospitals across New South Wales have been announced as vaccine hubs, 5 of them in regional areas. That will happen. So whatever it is going to be administered to everyone, the process is well and truly underway.
So that's for phase 1A, our critical quarantine workers and healthcare workers. So that'll be most likely with the Pfizer vaccine rolling out over the next month or so. It's actually really great that we've secured enough to be able to have some regional sites there too.
And how do you feel about the new advice in regards to masks in New South Wales?
We're a bit concerned that people may get lax again. I think interest ramped up just before Christmas, but we need people to still be alert to the risk of COVID. For as long as it exists in the world, it could exist here. And really the safest thing is to still be wearing a mask when you're indoors and can't physically distance. OK,
and so that's your recommendation, even though the incidence of COVID out there in the community is down to such a minimal amount, you still think wearing masks is important?
It doesn't hurt, and also the guidelines are going to be confusing.